to this mini-series of the inside knowledge for people with IBS about managing digestion throughout your life. I'm taking a different focus each week on supporting our digestion through childhood, the teenage years, through our childbearing phase if you're a woman, and also through menopause, and then finishing up with IBS in older people. I've already covered IBS in children and teenagers or young people, so today is about having IBS when you're pregnant and just after you've had the baby. I'll talk about how the gut might change in each trimester of your pregnancy, as well as symptoms that might get better or worse throughout the 9 months. Hello, welcome to episode 87 of the Inside Knowledge podcast for people with IBS. I'm Anna Mapson. IBS can affect people at any stage in their lifetime, and so of course it may happen that you've had IBS for a long time and then you become pregnant. And when we're pregnant, everything changes. It's not just physical changes, there's a lot of emotional and mental changes as well. Having had 2 children and 1 miscarriage in between, there's a lot that can go on mentally and emotionally, I know, as well as all the changes in hormones and what that might do to your digestion. Today I'm going to speak a little bit about each of the different trimesters of pregnancy, so that's each of the 3-month chunks of your 9-month journey, and then a little bit about how the postpartum period might be after you've had a baby, and a bit about supplements and diet for pregnancy. I also wanted to talk a little bit about that fertility or trying for a baby stage, because if you have got IBS, sometimes you may worry that your gut health is going to be affecting your chances of conceiving. The only ways that could affect it is if your diet's very restricted. So if you're not getting some of the key nutrients that you need in order to have healthy eggs, healthy womb lining, to allow you to have all the right nutrients, that could potentially play into your fertility chances. But at the same time, some people get pregnant on a very, very poor diet, which is very restricted, not eating much at all. Think about all the people who get pregnant by mistake and they weren't even trying. I know it's very frustrating when you are someone who's been trying for a long time and you want to look at all the different potential causes of why that might not be happening. I have worked with a few people in their fertility stages. I used to focus much more on sort of motherhood and pregnancy, but I don't do that as much now. But going back to the broad principles of like a basic healthy diet will be one of the best ways to try and get confidence, I suppose, in your body's ability to produce a baby. Because I don't underestimate the energy it takes to grow another human inside you. It is exhausting. And it can be anyway. Some people sail through pregnancy and just have a lovely time. When you have IBS and you become pregnant, what you typically find is that your gut slows down. So for people who have IBS-D and are much more prone to loose stools, frequent diarrhea, that kind of thing, it can almost be a bit of a relief because your digestion just naturally slows down. So you might have less diarrhea, less fast transit. That is because your body is trying to get as much nutrition out of your food as possible. And so by slowing down your transit time, it's your body's way of absorbing more nutrients and just making sure you're really extracting everything that you might need out of the food. If you're someone on the other side of the spectrum, people who have IBS-C and are constipation prone, you may find that your IBS gets worse when you become pregnant. The hormones that slow down digestion are progesterone. We get changes in relaxin as well. So that's like a hormone that helps to relax our joints to prepare for a birth. That can start slowing down your gut transit time as well from about the 2nd trimester onwards. So you're getting massive hormonal changes that can physically affect your gut transit time. You may also be feeling quite a lot of emotions at this time. Even if it's a baby that's been longed for and a pregnancy that you've been trying for, then there's a lot of emotions that come with becoming pregnant. Just thinking about how you're going to keep this baby safe, even from the beginning when it's still inside you. I think that feeling of being responsible, having an additional pressure, something else to look after, sometimes creates a lot more worry for people. They're really worried about their diet and making sure everything is perfect. That can also put pressure on your digestive system. When you are in fight or flight mode and you're a little bit more anxious, we tend to not digest our food quite as well. Maybe your stomach acid's a bit lower, and you may find that you're struggling to break the food down, maybe a bit more gassy. Now, with the slowing down of the digestion as well, you can also become more gassy because the constipation is like blocking the tubes and the gas is building up behind it. So as well as physical changes to your body, like you may start retaining more water, the uterus is growing, and so if you're someone who's been very sensitive to bloating, you may find it quite a strange sensation that your belly is bigger, even though you might not have the sensations of being bloated in the same way. So you might be distended, that feeling of the stomach being bigger than normal. This can be a little bit triggering for you if you've had really bad episodes of IBS in the past. The other thing is the very first trimester, people get very tired and exhausted, which makes it quite hard to think of healthy foods to eat. So you might struggle to want to create yourself a nice healthy meal because you're so tired. This is where trying to think of absolute basics, things that you can do that just give you enough nutrition, like put a baked potato in the oven and then just have a bit of fish or meat with it and a few vegetables on the side. Try and keep it to foods that you know work for you and your digestion. Now, whether you should do the low FODMAP diet in pregnancy is unknown, I suppose, and untested. Mostly, we don't recommend any sorts of restriction during a pregnancy because you're more likely to miss out on key nutrients. And one of the things about pregnancy is it's very clever method that the baby will literally leach everything out of you, and so you might be low in calcium because you're avoiding dairy, and the baby needs to grow new bones, new teeth, all of those things that we need calcium for. So calcium will be taken out of your bones, but what can happen is that leads you at more of a risk of osteoporosis further down the line. In a way, your baby will get everything it needs. It's the same with iron as well. Your baby will take all the iron out of your blood, and so you can be left feeling even more fatigued. So this is where taking a pregnancy specific multi-nutrient can be helpful, and it's one of the times that it is recommended we all take a multi-nutrient is during pregnancy. There are some key nutrients in there that are really important to help build your baby. Iron and calcium that can be low in your diet, and particularly when you are avoiding dairy, like I said, calcium can be low, and also iron because there's so much going on in terms of building your baby's blood system and all the blood that goes into the placenta. So those are two that are always in multi-nutrients. You might also want to look at a multi-nutrient that has omega-3 in it, particularly DHA, which is a type of omega-3 fatty acids. And this is particularly good for building a baby's brain. If you don't eat fish, then it's certainly something you might look at supplementing with, but always take the advice of your doctor in those kind of cases. Because pregnancy is a different sort of way of being, we do have to be very careful with supplements. So you don't want to take supplements that aren't necessary, and you don't want to overload your body with things that it doesn't need. For example, some supplements are not recommended during pregnancy. The main one to avoid in supplement form is vitamin A, because it's been known to cause birth defects in high amounts. And that's because vitamin A is a fat-soluble vitamin that gets stored in our body. It doesn't just rush through us like B vitamins and vitamin C. So also things like cod liver oil, which contain high amounts of vitamin A. So if you are taking any kind of other supplements other than a pregnancy multi, do check that it hasn't got too much vitamin A. The only food that it relates to is liver. So if you eat a lot of liver, then be careful. But it's not something that I come across very often. Most people are not consuming too much liver. In fact, I never meet people who like to take it. There's also some herbal supplements that aren't recommended during pregnancy. So if you're somebody who has SIBO and you know you have a bacterial overgrowth, sometimes the way you might treat it is by taking oregano, allicin or berberine, and these are antimicrobial supplements. The aim of them is to kill off the microbes growing in your small intestine. All of those have not been tested in pregnancy, and so they're not recommended to take whilst you're still pregnant and whilst you're breastfeeding as well. So if you have SIBO and you still want to work on your digestion whilst you're pregnant, it's definitely worth a conversation with your doctor about which kind of antibiotics might be suitable whilst you're pregnant. If there's nothing that's suitable for you and your health conditions, then what you can still do is just work on getting the best diet, the best kind of other surrounding options for SIBO that don't involve the kill phase. When you know you have an overgrowth of SIBO, it's really important that you try to get those microbes and that overgrowth down. Now, some of the ways you can do that involve your eating habits, eating regularly, those kind of things. So people often really worry about their eating pattern changing when they become pregnant. It's normally recommended as well when you're pregnant, especially if you get morning sickness, and although it's called morning sickness, people can be sick all through the day. You also might get a lot of advice to eat small, little and often. And if you've had SIBO for a while, you will know that this is the opposite of what is recommended for your digestion. This is one of those cases where you must listen to your body. If you need to eat little and often, I would just do that. Don't worry about trying to extend the eating window between meals and fasting overnight. This is not the time when we want to restrict any nutrition from our bodies. And if your body is hungry, that is a sign that you need to eat. And if you're particularly sick, then sometimes eating a little bit and keeping some food in your stomach is one way to manage that nausea. Some things that you can still do is ginger tea, which is good for gastric motility. So it helps your stomach emptying, and it's very good for nausea and will be okay in pregnancy. But the other things that we normally would advise in SIBO, like I mentioned, those antimicrobials, they're not recommended. As well as dealing with the constipation, you may find if you have low iron and you're given iron supplements from your doctor to correct this, that can also add to the constipation conundrum. So it's a real challenge trying to get a good healthy bowel movement when you are pregnant, and you don't necessarily want to take a lot of laxatives or other supplements or medication. We've got a couple of things that you can focus on. Maybe you can really try sitting on the toilet in a comfortable way. So that is using a small step, raising your feet up so your knees are higher than your hips. You can lean forward. That gets you into a better, almost squatting-like position that will allow the poo out easier. Just makes things much better, less straining, definitely. And also you want to focus on some soluble or gel forming fibres that help you retain water in the stool, because if you've got a slow transit time, more and more water is going to be reabsorbed through the large intestine back into your body. That's how we recycle a lot of our fluid. If that's happening to you because the muscles moving the food through are slowing down, more water will be reabsorbed. So what you want to do is you want to eat foods that help to retain that water level. So those gel forming foods such as oats, root vegetables like sweet potato, carrots, parsnips, these are good. They also happen to be low FODMAP, so they're not necessarily going to cause as much bloating. Then also fruits as well. So kiwi fruits, very good, really high in vitamin C, which will help you with your immune system. And you might just feel that you can get enough like that through foods, just really focusing on your fruits and vegetables and a good, healthy, balanced diet. However, if you're really struggling with constipation, I would go back to the doctor, back to your midwife, and ask what you can do about it, because they will be able to recommend particular laxatives that do just get things moving, because feeling additionally stuck when you already struggle with IBS is really difficult. As well as the hormonal changes that are slowing down your digestive system, you are also getting massive physical changes as a small human is growing inside your body. They're putting pressure on your digestive organs, so squeezing your small intestine, squeezing your stomach from the bottom upwards, which then pushes upwards, and a lot of women do get increased heartburn during pregnancy. Now, this doesn't necessarily mean you are suffering with ongoing heartburn. It could just be the positioning of your baby. So in that case, some of the things you can do is to take the Gaviscon, which performs a barrier over the top of your stomach, which helps to keep the stomach acid down in the stomach rather than letting it up. But you may also find if you've got increased constipation, increased gas, then you're getting a lot of bubbling and extra gas that's not just the baby putting this pressure on your lower esophageal sphincter, which is going to then open and let the acid up. So again, go back and speak to the doctor or the pharmacist, see what's available to you. But certainly we don't want to necessarily restrict foods that are going to be healthy, that sometimes if people are sensitive to acidic foods, they might cut out, such as tomatoes, oranges, maybe onions and garlic. If you're really finding they're exacerbating your symptoms, then you might want to reduce your intake of those. But you don't necessarily need to automatically cut them out in the same way that somebody who was suffering from acid reflux would do. Really going to be about how you react to it. The birth itself, depending on what kind of birth you have, can also affect your digestion in the postpartum period and sometimes for years afterwards. Having a baby is a massive physical strain on your pelvis and your lower half of your body. And I'm not saying that to put people off. It's just that our pelvic floor has been so stretched from carrying this big weight inside you. It can lead to changes in the pelvic floor muscles, either directly after the birth or for a little while afterwards. Sometimes people will find that if they have a tear or an episiotomy, which is when they cut you, this can sometimes lead to problems having a poo afterwards. Of course, it's very painful directly afterwards as you bear down to open your bowels and have a poo. It's putting pressure on that same place which has been stitched up. So that can be very painful. Sometimes people find sitting in soothing little baths, like very shallow baths, just to relax the skin and try to heal it. That can be helpful and a good way to clean yourself afterwards. But definitely talk to your healthcare providers about how best to manage that. After your baby arrives as well and you start to begin to eat after the birth and just in the next couple of weeks, you need to really fuel up your body. This is no time to try and, snap back into your jeans or whatever the magazines or, blogs might have you thinking about. Do not think about weight loss. Each of the cells in our body turns over at a different rate, and some will be renewed quite quickly. So for example, our gastrointestinal tract from your mouth right through to your bottom will be renewed every 3 days because there's a high turnover of cells. But our bones, our skeleton, can take, I think it's 7 or 10 years to completely turn over. So throughout that period, there will always be some cells that have been affected by pregnancy. It's like your body is still dealing with that pregnancy for years and years later. So whilst you are becoming a parent, your child is growing up, even going to school, there are still cells that are turning over after you've been pregnant. So I think it's worth thinking about this huge impact on our body. It's not just once the baby's out, you're done, you're recovered, you're no longer pregnant. You've still got traces of having been pregnant in you for a long time. And I think just considering that in terms of your nutritional rehabilitation is also important. So particularly important if you're breastfeeding as well, that you are getting all the different good nutrition that you need. Of course, it's helpful for everybody to really fuel themselves up, to think about all these different colours of plants and vegetables that you should be eating to make sure that you're getting sustaining carbohydrates, proteins to fuel muscle recovery and growth and healing as well. But if you're also breastfeeding on top of that, then you need to think about protecting your own calcium levels, maybe vitamin D, because this will be taken from your body in order to make the breast milk as good as it can be. And so that could leave you at a risk of not having enough vitamin D, for example. So this is where making sure you've got the right kind of diet that's covering all the bases. Now, after the birth, you may find your pre-pregnancy IBS symptoms come back. So if you are used to having very fast transit time and diarrhea, once you're no longer pregnant and the relaxin is starting to leave your body, you may find that you return to looser stools. I worked with someone a little while ago who was about 4 months after having her baby, and her diarrhea was really significant. She could hardly leave the house, and it was stopping her going to singing groups with the baby at the library and avoiding meeting her friends out of the home because she was so worried about having accidents. And some of that we worked through was around anxiety as well about her body and anxiety about becoming a parent. But there was also massive food element to it. So getting the right nutrition, the foods that don't set off your diarrhea, is very helpful. If you're breastfeeding, again, like there's a lot of restrictions on what you can and can't take. I worked with someone last year who had, well, we thought she potentially could have methane dominant SIBO, but she didn't want to stop breastfeeding her baby, of course. And all the supplements that you can take, again, like I said, to reduce it, are not recommended during breastfeeding either. And so there was just some things we could do through diet, through lifestyle, through eating patterns that really made a difference, but you can only take it so far until the point when you're not breastfeeding. She also, interestingly, really felt that breastfeeding and the relaxin hormone was really slowing down her digestion. And in a previous pregnancy that she'd had, when she stopped breastfeeding afterwards, then her constipation got better. So it's a mixed bag, I'd say, in terms of having a baby and what it does to your symptoms, just like everything else. You know, some people find their stress makes their constipation flare up. Other people find it makes them go to the toilet. Some people, alcohol really sets them off. Other people won't find that. So the same with pregnancy. It may be completely fine. You may not have a problem at all with any of your digestive symptoms, and you may actually find it a nice little break from your symptoms whilst you're pregnant. I know I'm getting to the end of my 20-minute segment now, but I really wanted to also say that as well as not focusing during that postpartum time on weight loss, just to really go easy on yourself in terms of being perfect as well. If you need to live on ready meals from the supermarket, that's also okay. Food is food, and you need to just look after yourself, because having a baby is a huge change to your life. And no matter how confident a career woman you are who's handled managing call centres or massive multi-million pound deals, it's so different when you're at home on your own with a baby. It's a completely different world, and sometimes that can just be overwhelming in itself. So if you need to take an easy route and get meals delivered in and eat ready meals all the time, then that is what you need to do. And it won't be forever, and life will change. There's a balance, isn't there, between trying to do the best you can for your body and not striving for perfection. There's so much you could say about nutrition in pregnancy and healthy diets in the postpartum period. It's a huge amount to squish into 20 minutes, but I hope that has given you a few things to think about if you're pregnant or if you're about to have a baby. So thanks for listening to this episode of the Inside Knowledge podcast, Better Digestion for Everyone.